Hi, have you realized that the most common time when people get heart attacks or sudden deaths is late night and early morning most of the times and not afternoon or evening? Have you thought why? Why should a person get heart attack or sudden death when he's actually sleeping in deep sleep and not working? Worldwide research and statistics have clearly proved that obstructive sleep apnea, a condition in which a person stops breathing during his sleep, is most commonly responsible for this event. So let us today understand what is obstructive sleep apnea. Snoring is a very common problem. Every family has a snorer, but obstructive sleep apnea is just an extension of the same snoring problem. So come, let's see what is snoring and what is obstructive sleep apnea. So as you can see here, this patient while snoring stops breathing and again goes back to snoring. So this cycle keeps on repeating on itself throughout the night. So what happens inside is the airway is blocked by the fall of the palate or tongue or both, and then the brain wakes up the patient so that he can regain breathing again. So this results in disturbed sleep throughout the night. The patient is unable to go into the deep stages of the sleep. He remains sleepy throughout the day, and ultimately it results in development of blood pressure, diabetes, and even heart attacks. So you realize that obstructive sleep apnea is a dangerous condition and can happen to anybody. So are you at risk of having obstructive sleep apnea? Let's quiz. I'll ask you 8 questions. Take a paper and pen and start giving yourself marks. For each yes, give a 1, and each no, give 0. Okay, so let's start. Do you snore loudly? By loudly, I mean louder than talking or loud enough to be heard through closed doors. If yes, give yourself 1 mark. If no, give yourself 0. Do you feel tired, fatigued or sleepy during daytime? When you're driving, when you're reading, when you're seeing television? Yes, 1 marks. No, 0 marks. Have anyone, I mean your wife or your husband, observed you stopping breathing during sleep? It's a very important thing. If somebody has observed you and said that you choke during sleep, give yourself 1 mark. Do you have blood pressure, or are you being treated for blood pressure? If yes, give yourself a mark. Are you quite obese? That means your body mass index is more than 35 kg per meter square. If yes, give yourself a mark. Are you over 50-year-old? If yes, again 1 mark. Is your neck circumference more than 40 centimeters? If yes, 1 mark. Are you male? Unfortunately, if you're male, give yourself 1 mark. So these are the 8 questions. Now calculate how many marks you have got. If you've got more than 3 marks, you are at risk of obstructive sleep apnea. If less than 3, you are having less risk of having obstructive sleep apnea. So if you are having obstructive sleep apnea risk, then you must undergo a sleep study. What do we do in sleep study? Either in the hospital in the sleep lab or at your home, you sleep naturally. And during your natural sleep, the polysomnograph or the sleep study machine detects the pauses in the breathing that you have, detects the changes of the heart rate and the oxygen saturation that your body has during the whole night. And it calculates in the morning by the software how many times you stopped breathing per hour. In 1 hour's time, how many times your breath was stopped? What was your oxygen saturation? And what happened to your heart rate during that period? So once we see everything, we assess the risk of sleep apnea into 3 categories: mild, moderate or severe. So 0 to 5 times per hour is normal, 5 to 15 times per hour is mild, 15 to 30 is moderate, and more than 30 is severe. That means if somebody is having severe sleep apnea or AHI of 30, that means in 1 hour's time, in 60 minutes time, his breathing is stopped 30 times, which is pretty dangerous. Every 2 minutes, the breath is stopping. And to your surprise, you'll know that the sleep studies that we do, we see many patients with indexes of 50, 60, 70. That means every minute the breath is stopping. Now, if you are diagnosed with sleep apnea, you have two options. You can use a CPAP mask throughout life, every night, so that it can give additional oxygen or air to your airway and to keep it open, or to get operated. Traditionally, sleep apnea has been treated with CPAP mask, a mask which provides air at a high pressure through the nose of the patient to keep the airway open. But unfortunately, more than 2/3 of the patients do not tolerate the CPAP mask and are left untreated. As you can understand, if there is an obstruction causing the traffic jam, the most logical solution to this problem is not squeezing through. The thing which CPAP exactly does, it squeezes the air through the narrow air passage. So people do not tolerate it. The most logical solution to the problem is to clear the obstruction so that the airway is wide open. So if you are not comfortable with the CPAP, then if you are going ahead with surgery, we have to know which part of the airway has to be operated and cleared. So how do we know that? We do certain tests called the CT scan of the sinuses and a drug-induced sleep endoscopy. So the CT scan of the sinuses is done to estimate the blockage in the nose, whereas the drug-induced sleep endoscopy is done to decide whether your palate or the tongue has the problem, or even both, if at all. So let's see how it is done. In sleep endoscopy, we make the person sleep under effect of medicines and then put a tiny camera inside the nose to look at the throat, the airway. As you can see here, this patient's airway is completely collapsed, and after almost 15-20 seconds, it is opening up. As you can see here, this patient's airway is completely being collapsed by the fall of the heavy base of tongue onto the epiglottis. So this patient cannot tolerate the air blast of CPAP even for a second, which further blocks it completely. Surgery is often considered unsafe for obstructive sleep apnea because it is on the airway. But in properly equipped centers, in experienced hands, and with technologies like coblation and robot, the surgery is pretty safe and absolutely effective. So remember, weight reduction is definitely very effective in the management of sleep apnea, but it's not the only thing that is going to cure it, because the problem is always in the anatomy, and there are no medication which are going to actually cure you of sleep apnea. So please do not laugh at snorers. They're not laughing stock. Snoring can be dangerous, it can be life-threatening. Please observe your near and dear ones during late night. If at all you think they're stopping to breathe, please get their sleep studies done. Thank you very much.